All right, welcome everyone. Thank you for joining us today for our national webinar series. Today's webinar topic is Child and Family Wellbeing System, Economic and Concrete Supports as Core Components. My name is Karis Manus. I'm a Senior Associate for Learning and Dissemination here with the National Community Action Partnership, and I'll be working behind the scenes today to help the webinar go smoothly. A few technical notes as we get started. The webinar will be recorded, and we'll be sharing both the recording and the slides in a follow-up email within 1 to 2 days following the presentation. If you have any questions or comments during the presentation, please feel free to submit those through the chat function, and we'll address them as time allows. We want to begin with our land acknowledgement that every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led to this moment. Some were brought here against their will, and some were drawn to leave their distant homes in hope of a better life, and some have lived on this land for more generations than can be counted. Today, I am joining you all from my home in North Carolina, and for me, this meeting is being held on the traditional lands of the Lumbee people. I pay my respect to elders both past and present who have stewarded this land throughout the generations, and will invite you to share with us in the chat where you're joining us from today as well, and we'll share a link for you to do so. We also want to begin by grounding ourselves today in the promise of community action that brings us all together today. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. And before we get started today, we do have a quick poll. We want to find out who's joining us today and find out some more information about you. So I'm going to share So on your screen, you should see, and I will share it in the chat as well, there's a QR code, or you can go to menti.com and enter the code 78628000. And once you have that pulled up, you should be able to see the screen with the quick poll. So the first question that we have, once you all get there, and if you want to give me a thumbs up so I can see that others, okay, I see some thumbs up coming through. All right. Our first question is, which description best represents your role at the Community Action Agency? So do we have executive directors, CEOs, program director, program manager? So we've got a lot of program directors and managers on the call with us today. Case manager, coach, or family advocate, intake specialist, resource navigator, or other. And if your role is other, if you're welcome to share with us in the chat what that role is as well. Looks like those are starting to slow down a little. Our next question is, what is it about the topic today that caught your interest and motivated you to join the webinar? So what are you looking forward to learning or taking away from today's presentation? What was it that drew you in? Economic equity, concern for our families, referred by a supervisor who wants to strengthen relationships between CAAs and state around child welfare, concrete supports, the linkage between child welfare and wellness and community action, well-being. We need ideas to move families, not just deliver transactional services, general information, increased access, supporting families in my program, resources for child and family support, increasing knowledge on supports. We are starting family resource centers in my state, and I'm making connections from CSBG to RFCs. Multidisciplinary team approach, learning more about the program in general and how to strengthen CAA relationships with the state. Impacts of mandated reporting versus supporting family needs. How this connects with 2Gen. These are great. Thank you all so much for sharing. We're looking forward to getting started. Thank you all so much. All right. So joining us today to provide some background and context for today's presentation is Jeannie Chapin. Jeannie is a special advisor with the National Community Action Partnership. So I will hand it over to Jeannie to get us started today. Thank you all again.
Thank you, Karis, and thanks to all of you today for joining us. This is a second webinar that we've had planned with our colleagues from Chapin Hall. We had one earlier this month, and if you didn't get to join that event, we'll share those slides out with you when we share these slides. We're so excited to bring this to the network and to provide this opportunity for you to learn a little bit more about the benefits of concrete economic supports in supporting families and children. And as many of you just noted in that little Menti, this is the work that we do, right? We focus on families and well-being, and we are trying to form stronger relationships with our child welfare colleagues locally. And so I think this will be very helpful to all of you that listed those kinds of things in the opening here. I wanted to just set the stage a little bit and sort of give you some background here about what the partnership has been up to with Chapin Hall for really over a year now. We've been collaborating with our colleagues at Chapin Hall, who really do focus on research and applying research in local places to improve conditions for children, youth, and families. And Chapin Hall is actually located at the University of Chicago. And there's just some of the greatest researchers and practitioners from the child welfare field working to really build capacity, strengthen conditions for children and youth, especially homeless youth or youth that are at risk of being homeless. And so we've been entering in a conversation with them at the partnership about how we can bridge these two areas, community action and child welfare, and do better for families. And so we're pondering how to bring Chapin Hall's child welfare experience, the partnership's community action experience together with folks in local communities, really parents and folks at the grassroots level, and imagine transforming the system from really a child welfare system to a child well-being system. And we've got a little graphic that we've been using to show this cohort model, and we've been testing this idea in conversations. I think I see some people here in the participant list that we've been visiting with over the last year to sort of think about what would it mean to bring expertise from Chapin Hall and from the partnership together in local places, and really try to put decisions and power back in the hands of parents and families and people at the community level versus at the state or system level. So our webinar earlier this month, we talked about what it means to build community pathways for families and children. And then we're going to talk about this idea of, providing concrete economic supports to really go upstream and prevent issues before they happen for families. Many of you in Community Action are doing that every day with the work that you do to support families with children. And I think you'll find the research that we're going to hear about today helpful in your work and sort of hopefully your future work. So we have a lot to get through. So, keep that context in mind, and we want to get right into it and make sure that you have plenty of time to hear from our good presenter today. So our presenter today is Yasmin Graywall-Koch. And she is a policy fellow at Chapin Hall at the University of Chicago. And her work has really focused on supporting large-scale system change to positively impact the lives of children and families, and particularly those that are marginalized. And she brings expertise in cross-sector partnerships and early childhood, child welfare research and policy, and has over a decade of legal experience in both the private and nonprofit sectors. As a policy fellow at Chapin Hall, Yasmin leads efforts to provide research-driven implementation and capacity building assistance across the country. And she is co-leading Chapin Hall's economic and concrete supports portfolio, is a national thought leader on economic and concrete supports as a child welfare prevention and race equity strategy. She's also currently guiding several child welfare agencies in their efforts to leverage the Family First Prevention Services Act to build child and family well-being systems. So we're going to hand it over to her, and really excited to have everybody learn more today. Thanks.
All right, everyone. I hope you can see my slides. Thank you so much, Jeannie, for that amazing introduction. I'm thrilled to be here today to present to you all about economic and concrete supports as a core component of a child and family well-being system. I'll be talking about the intersection of family economic insecurity, race, and child welfare involvement. And then I'll focus on what the research tells us about the relationship between increased access to economic and concrete family supports and reduced risk for child welfare involvement. I'll also share a vision for the pathway forward. Given the limited time we have together today, I'll be presenting a very abbreviated version of the longer slide deck and resources that are available on Chapin Hall's website, which you can access via the link on this slide or the QR code. I'll be sharing a lot of information today, but my goal is to make it as accessible as possible. And we'll have time both during and at the end of my presentation for discussion, reflection, and to answer any questions you might have. You'll also be receiving my slides after this presentation, so you'll be able to use them as a reference. You can share them, and you might want to just spend some more time with them. So let's get started with this high-level overview of the body of research on the association between economic and concrete supports and child welfare involvement. In general, reduced access to economic and concrete supports is associated with increased risk of child welfare involvement and child maltreatment, while increased access to economic and concrete supports is associated with decreased risk of child maltreatment and child welfare involvement. This ever-growing body of evidence is consistent across time and types of studies, from Pelton back in 1978 and extending to studies recently released in 2023. I'll be sharing a study today that was released a few weeks ago. Economic and concrete support evidence is also consistent across mechanism, meaning that economic and concrete supports are associated with reduced risk for child welfare involvement, regardless of the type of support provided to families, including cash assistance, childcare, housing, healthcare. And importantly, economic and concrete supports evidence that I'm going to share with you today is actionable and can inform evidence-based policy making. I think it's important to start this conversation with a historical perspective, to look at how U.S. child welfare policy and structure has been a reflection of our choice points, and to recognize the impact that those historical policy choices have on our systems today. So I know there's a lot of text on this slide, but this timeline shows how policymakers repeatedly separated programs designed to address poverty from programs designed to protect children. You can see in 1935, the Social Security Act bifurcates supports to families by nesting aid to dependent children, which later became AFDC, under the Social Security Administration, but social services went under the Children's Bureau. In 1960, what became known as the Fleming Rule was implemented in response to some states denying ADC, which later became AFDC, benefits to families, mostly Black families, because their homes were deemed quote unquote unsuitable. This rule declared that states could not simply ignore the needs of children in households deemed to be unsuitable, and required states for the first time to either, one, provide supports to these families, or two, remove the children and support them in foster care. In 1961, the Social Security Act amendments established AFDC-FC, which later became Title IV-E, as an open-ended entitlement for foster care services, which addressed Part 2 of the Fleming Rule without establishing analogous funding for family support services to address Part 1 of the Fleming Rule. Then in 1974, the Child Abuse Prevention and Treatment Act, known as CAPTA, required state-mandated reporting laws, but did not include guidelines, training, or opportunities for reporters to explore alternative family support options. Going to the end of the timeline to the Family First Prevention Services Act of 2018, we note that while this landmark law provides federal funding for prevention services to keep families together, it does not explicitly include economic and concrete supports, and focuses on treating the parent or child rather than the context in which families live. So as a result of all of these policy choices, economic and concrete support programs are administered as if unrelated to child welfare, and the root causes of child maltreatment have not been consistently addressed, perpetuating family separation, structural racism, and intergenerational trauma. So what's the impact of these historical policy choices? We think it's a combination of economic hardship that families face, a fragmented and siloed human service system, deficit-based, rigid, and piecemeal policies, mandated reporting laws, which was noted in the original Menti that asked people why that they wanted to join this call. Mandated reporting laws have resulted in high numbers of reports, the majority of which are unsubstantiated, plus disparate access to and lack of sufficient economic and concrete supports have resulted in overloaded and destabilized families, unmet service and support needs, high rates of reported neglect, deployment of the authority to investigate and remove children, and child welfare involvement. I'll be talking about many aspects of this framework in my presentation today. But let's start with an overview of family economic insecurity, income, and child welfare involvement. Data shows us that consistently around 60% of substantiated Child Protective Services, or CPS, responses nationally involve neglect only. I highlight this number because we often suspect that cases involving neglect are secondary to poverty. The research I'm going to share with you today shows us that the provision of economic and concrete family supports is associated with decreased risk for child welfare involvement due to both neglect and physical abuse. So we need to look beyond just the neglect numbers. Research shows us there's a strong relationship between family economic insecurity and child welfare involvement. Nearly 85% of families investigated by CPS nationwide have incomes below 200% of the federal poverty line. I want to spend a little bit of time on this important recent study because the findings are really interesting. It found that the relationship between child poverty rates and CPS reporting rates at the county level has intensified by almost 40% from 2009 to 2018, particularly for neglect. This means that the impact of poverty on child maltreatment reporting rates has actually increased over time, and it highlights the increasing importance of poverty as a predictor of CPS reporting rates. The authors of this study hypothesized that the substantial and steady increase in income and wealth inequalities in the United States over the last several decades suggests a deterioration in the economic conditions among families at the bottom of the income and wealth distribution. These worsening economic conditions might have intensified poverty's impact on maltreatment rates. The authors also offer two core approaches to reducing child maltreatment through economic means. The best approach would be to build policies and practices to reduce the level of economic hardship for families in general. So this is more of a population level approach. The second approach would be to reorient human services to recognize the core and expanding importance of poverty as a fundamental threat to human functioning. I really want to highlight that language because it stuck with me. Under this approach, the authors offer some concrete examples, which I think you'll find particularly relevant. Child welfare services could benefit from increasing material support to the families they serve, either directly through emergency funding or indirectly through forging relationships with community agencies addressing economic stress. Although low household income has been a focus of poverty research, material hardship is common amongst American families. And research increasingly indicates that families who experience material hardship may be at particularly high risk for child welfare involvement. So what is material hardship? It's generally defined as having difficulty paying for necessities, such as housing, utilities, food, or medical care. This longitudinal study looked at what happens when families who are low income experience material hardships. It found that experiencing any material hardship is strongly associated with an elevated risk for CPS involvement, regardless of the type of investigated report. Specifically, when families who are low income experience at least one material hardship, they're 3 times more likely to be subject to a neglect investigation and 4 times more likely to experience a physical abuse investigation. And when these families experience multiple types of hardship, after not having experienced any hardship, the impact is even greater. They are up to 7 times more likely to experience a physical abuse investigation. Let's look at some of the predictors of child welfare involvement. On the left side of the slide, a recent systematic review found that the most reliable economic predictors of child welfare involvement are income loss, cumulative material hardship, and housing hardship. On the right, you can see which types of hardship are most predictive of investigated neglect reports. Things like food pantry use, difficulty paying rent, utility shutoff, and inability to receive medical care. There's been some interesting research on the association of negative earning shocks and increased risk for child welfare involvement. Negative earning shocks, are unexpected and significant reductions in income, such as a job loss. In this study, they defined it as a reduction in earnings by 30% or more from one quarter to the next. This study found that for families with recently closed CPS investigations, so most of whom were low income, experiencing a negative earnings shock was associated with an increased risk of subsequent CPS investigation by 18% and an increased risk of subsequent physical abuse investigation by 26%. The same study found, however, that the association between negative earning shocks and risk for child welfare involvement actually diminished when earning shocks were compensated by the receipt of public benefits. The researchers suggest that having access to sufficient public benefits when earning shocks occur effectively buffers families against the risk of child welfare involvement. And this buffer is particularly strong for families with young children, who are associated with a 50% decrease in risk for physical abuse investigations when they're able to access sufficient public benefits to offset negative earning shocks. I want to take a little bit of time to explore the context and drivers of family economic insecurity and child welfare involvement. This slide shows us that economic insecurity is widespread in the United States, but families are not always static. They cycle in and out of poverty. On the right side of this slide, you'll see the data shows us that families move in and out of poverty over time. Almost 50% of those who become poor are out of poverty a year later, but more than 50% of those who previously left poverty will return to poverty within 5 years. We believe the volatility and turbulence that's created by entering and leaving poverty may create serious stress for parents and impact parenting. Building on this idea of volatility and turbulence, this study shows us that low-income families at risk for child welfare involvement who experience income instability are at increased risk for child maltreatment investigations, even after controlling for household income level. This suggests a unique relationship between family income instability and child welfare involvement. So how might economic and material hardship impact parenting and child well-being? One potential pathway is called the family stress model. This model proposes that economic hardship not only deprives children of critical material needs, it also adversely impacts family dynamics. Research into behavioral economics and the psychology of poverty indicate that economic instability destabilizes families, creating stress and high cognitive loads, which drain mental resources and can lead to increased hostility and conflict. This in turn can disrupt nurturing, responsive, and supportive parenting and place children at higher risk for child welfare involvement. I do want to emphasize that while this model focuses on the family unit, it's important to always consider families within the context of their communities, cultures, policies, and systems, all of which impact their well-being. We created this visual based on the evidence to show how multiple hardships can overload families and increase their risk for child welfare involvement. Here, as more boxes get loaded on this truck, they get too heavy and the truck starts to break down. So what happens to the family when we start to take some of those boxes off the truck bed? We'll explore what the research tells us later on in this presentation. This is an important recent analysis that simulated the effects of increased household income under 3 of the anti-poverty packages that were included in the National Academy of Sciences Roadmap to Reducing Child Poverty Consensus Report. You can see a description of what was included in each of those 3 packages in the box on the right. This analysis found that implementing these packages could reduce CPS investigations by 11 to 20%, depending on which package was implemented. And importantly, I want to highlight that it found that implementation would substantially reduce racial disproportionality in CPS involvement, with up to a 29% reduction in investigations for Black children, compared to a 13% reduction for white children. Those last findings lead to the next section of my presentation that's focused on how economic and concrete supports are a race equity strategy to address disparity and disproportionality in child welfare. As I previously discussed, research demonstrates that economic hardship puts families at increased risk for child welfare involvement. Due to past and ongoing systemic inequities, racism, and discrimination, families of color are more likely to experience economic hardship, and this may contribute to their disproportionate child welfare involvement. Therefore, economic and concrete supports to stabilize families and prevent child welfare involvement may be an important mechanism to reduce racial disparities. It's important to ground this conversation in the current and historic systemic inequities that put families of color at disproportionate risk of economic hardship in the United States. We've listed some examples here, but this is by no means an exhaustive list. We know that children and families of color are more likely to experience poverty than white children. As this graph shows, in 2019, more than 30% of Black children and 30% of Native American children lived in families with incomes below the federal poverty threshold, compared to 10% of white children. Research and policies aimed at addressing poverty tend to focus on family income. Family income, however, doesn't show us the full economic reality of families in the United States. For that, we need to look beyond income and consider household wealth. So wealth or net worth is the total value of household assets minus total debts, such as mortgages, credit card debt, car, educational loans. Wealth is a critical resource that enables households to deal with unexpected economic shocks, such as job loss. Because in these circumstances, parents have to draw on saved assets to meet the needs of their children. Due to past and ongoing systemic inequities, there is a significant, I might say a staggering racial wealth gap in the United States that further exacerbates the consequences of economic insecurity for families of color and may impact their risk for child welfare involvement. As the graph on this slide shows, as of 2019, white families held 8 times more wealth than Black families and 5 times more wealth than Latinx families. I want to note there's very little research on the assets and debts of Native American households. The most recent estimate I found from 2000 was that Native American households own 9 cents for every dollar of wealth held by white households. While CPS interventions are pervasive for all children in the United States, with 37% of children subject to an investigation by age 18, they're particularly pervasive for Black children. As this graph shows, it's estimated that over half of all Black children will be subject to a CPS intervention by age 18. In sum, providing more economic and concrete supports may be an opportunity to rethink the role of CPS in the lives of children and families, and in particular for families of color. I've talked a lot, so I want to give you all the opportunity to reflect and share in the chat something you learned or something that was surprising to you in this presentation so far.
Yasmin, I will say that we have a good positive reaction to your video about the compounding impact or the visual of the truck. People like that. I'm
glad to hear that resonated.
Yeah, I think it did. Folks are saying they're surprised that the wealth gap is still so large, and the rate of CPS involvement is staggering, really, really upsetting.
Yeah, I mean, I've heard some researchers say it's become normative.
The cycle in and out of poverty is much sooner than I realized. Over half of all Black children experience CPS interventions. That is shocking to me. I'm feeling this physically right now. I had no idea this was so high.
Yeah, it is shocking, especially when you think about the effects, not just on that child, but their family, their community, their relatives, the trauma that ensues from an investigation and the fear, you can't really monetize that. You can't really measure that. But we all know it exists.
I've heard that accessing social services places families under greater surveillance and thus increased risk of reporting. Have you seen this? How does that relate to your data about the benefits of accessing services?
Yeah, I think it's a really important question and something to consider, because our research shows that accessing public benefits is actually a buffer against child welfare involvement. But many studies show that accessing public benefits is also a driver of child welfare involvement. So I think it's a conundrum, but we think that it could be that families who are touching all of these systems are under increased surveillance, and so they're more likely to be reported to the child welfare system through mandatory reporting. But it could also be that they have complex needs and they're not getting adequate public benefits to keep them from getting involved with the child welfare system.
Somebody's mentioning the cost of affordable living, affordable housing in America, and what that may be doing. And then also just surprises about the racism that still exists at this point.
I'm going to be touching on housing and some other studies that I think you'll find interesting. And we'll have time to reflect and discuss at the end of my presentation. But let's go ahead and continue, because I have a lot more I want to share. Let's talk about what the evidence tells us about the relationship between economic and concrete supports and child welfare involvement. So first, what exactly do we mean by economic and concrete supports? We consider them to be broad, to include things like cash assistance, earned income tax credit, income, employment, SNAP, housing supports, childcare, and Medicaid. And I'll be sharing a lot of research around each of those types of economic and concrete supports today. So what does the evidence suggest happens when economic and concrete supports are reduced? I want to talk briefly about the sources of evidence that are included in my deck today. We have to be careful about making generalized interpretations from this body of research, since each of the studies I'm going to share has different limitations. There are only a handful of studies we cite that are randomized controlled trials, which are considered the gold standard of research because they can assess the causal impact of interventions. But most of the research in our deck demonstrates associations and correlations, not a causal impact. And this means that other factors may play a role in the results and in the findings. We like to emphasize that the studies in this deck shouldn't be considered in isolation. Rather, taken together, we think this body of science expands our understanding of what has been effective and why, and informs potential policy shifts and new pathways. So now getting to this slide, based on the research we've compiled, this slide provides an overview of the types of economic and concrete supports that, when decreased, are associated with increased risk for child welfare involvement. This includes things like reduced TANF benefits, lack of childcare and stable housing, reduced employment and income, and increased gas prices, meaning families have less disposable income. I'll focus on a few of these findings today. Let's start with TANF. There's an ever-growing body of evidence on the relationship between access to TANF and risk for child welfare involvement. This study examined the effect of TANF policy changes and benefit restrictions from 2014 to 2015 on child welfare involvement. It found that states that implemented total benefit loss as the most severe sanction for not meeting TANF work requirements saw a 23% increase in substantiated neglect reports, a 13% increase in foster care entries due to neglect, and about a 13% increase in total foster care entries. When one looks at this impact, it's really important to keep in mind the first statutory goal of TANF, which is to provide assistance to needy families so that children can be cared for in their own homes or with relatives. I also want to point out that in 2021, states were holding up to $6.2 billion in federal TANF funds in reserve, which they're allowed to do, with some states holding zero in reserve and others holding as much as $1.2 billion. If you click on the link on this slide, you can see how much each state is holding in reserve. The study I just shared also found that states that implemented TANF time limits of less than 5 years saw a 34% increase in substantiated maltreatment reports and a 37% increase in substantiated neglect reports. There's also quite a bit of research on the relationship between access to childcare and childcare subsidies and child welfare involvement. The study in the top bullet found that for every childcare concern reported by families receiving TANF, the risk of supervisory neglect increased by 20%. The study in the other bullet on this slide found that mothers entering substance abuse treatment who had difficulty securing childcare were 82% more likely to self-report child neglect compared to mothers entering treatment who didn't have difficulty securing childcare. It's particularly interesting to note that difficulty finding childcare was a stronger predictor of maternal neglect than almost any other factor measured in this study, including mental health and severity of drug use. For working mothers who are low income, instability in childcare arrangements is associated with increased risk for self-reported physical and psychological aggression toward their children, and not having access to emergency childcare is associated with increased risk for self-reported neglectful behavior, especially for single mothers. During the Great Recession, the rate of abusive head trauma for children under 5 years old was considerably higher than during the period immediately before. Let's talk about housing. It's estimated that inadequate housing contributes to the risk of entering foster care for 1 out of every 6 children involved in CPS investigations. This slide provides an overview of the body of research on the relationship between housing stress and increased risk for child welfare involvement. You can see the specific types of housing stress that have been associated with increased risk for child welfare involvement, which includes child maltreatment, CPS investigations and substantiations, and foster care placement. I want to point out that households experiencing a foreclosure filing are associated with increased risk for child welfare involvement. I realize most families involved with the child welfare system are renters, not homeowners. Although homeowners are generally more socioeconomically advantaged than renters, the research on foreclosure filings suggests the role of stress and economic shocks, the role they might have on child welfare involvement above and beyond poverty or income. Now let's talk about what the evidence suggests happens when families have increased access to economic and concrete supports. Let's consider how economic and concrete supports might positively impact child and family well-being. We previously saw the family stress model. Now let's think about the family investment model. According to this theoretical pathway, when families have enough resources to meet their basic needs, they can invest in services and opportunities for their children. They can access housing, childcare, and educational opportunities. Families are able to provide nurturing, responsive, and supportive parenting, which leads to improved child and family well-being and lower risk for child welfare involvement. This is a summary of the types of economic and concrete supports that, when increased, are associated with decreased risk for child welfare involvement, based on the research we've compiled at Chapin Hall. They fall into 4 categories: macroeconomic supports, concrete supports, public benefits, and child welfare interventions augmented with economic and concrete supports. I'm going to share a few of these studies with you today. Let's start with this important analysis, which looked at state spending on public benefit programs, including cash assistance, housing supports, childcare, refundable EITC, and Medicaid. It found that each additional $1,000 that states spend annually on public benefit programs per person living in poverty is associated with a reduction in child maltreatment reports, substantiation, foster care placements, and child fatalities due to maltreatment. These findings suggest that state investments in public benefit programs are a population-level strategy to prevent child welfare involvement. The analysis also found that if states increase their investment in public benefit programs by 13%, it would lead to significant long-term cost savings due to reduced child maltreatment-related costs. This is the newest analysis on our deck. It found that on average, an additional $1,000 unconditional cash payment to families in the early months of a child's life is estimated to reduce the likelihood of a CPS referral for neglect by 10% by the time their child turns 3, a CPS referral for physical abuse by 30%, a substantiated CPS referral by 15%, and child mortality by 30% by the time the child reaches age 5. There's a growing body of evidence showing that tax credits are associated with decreased risk for child welfare involvement. This study found that the earned income tax credit and child tax credit payments are associated with immediate reductions in state-level child maltreatment reports. Each additional $1,000 in per-child tax refunds is associated with a decline in state-level child maltreatment reports of 2.3% in the week of payment and 7.7% in the 4 weeks after payment. So why higher in the 4 weeks after payment? The authors hypothesized that this may be related to the length of time it takes for families to resolve their debts or other financial burdens after they receive tax credit funds. Several studies demonstrate the potential impact of a refundable state-level EITC in particular, which means that families can receive a refund even if they don't owe any taxes. I want to highlight the study on the bottom of this slide, which analyzed data from 14 states with and 13 states without a refundable EITC from 1995 to 2013. And it found that a refundable EITC averaging $400 per year was associated with a decrease in hospital admissions for abusive head trauma for children under 2 years old, even after controlling for child poverty. This map shows which states have implemented refundable as well as non-refundable EITCs. As of August 2023, 29 states, DC, Guam, and Puerto Rico have a refundable EITC. Not as many states have implemented refundable CTCs, but we're seeing increased state legislation across the country to enact state-level CTCs, in part due to the success of the expanded child tax credit that was sent to families during the pandemic. As of August 2023, 11 states had enacted a state-level refundable CTC. I want to point out that Minnesota's new refundable CTC is the nation's most generous and is predicted to reduce child poverty in the state by 33%. This study looked at child maltreatment reports from 2004 to 2013 and found that states that increased their minimum wage above $7.25 an hour experienced a reduction in child maltreatment reports. It estimated that for every $1 increase in the minimum wage, there was an almost 10% decline in neglect reports. This slide provides an overview of minimum wage standards across the country. Note that a worker paid the federal minimum wage today, which is only $7.25 an hour, earns 40% less than a minimum wage worker in 1968 when adjusted for inflation. This study looked at the population rate of hospital admissions due to abusive head trauma in California before and after its 2004 paid family leave policy went into effect, and compared it to 7 states with no paid family leave policy. It found that California's policy was associated with a decrease in hospital admissions for abusive head trauma among children under 1 year old and among children under 2 years old. This is a particularly interesting study. It used the inconsistent adoption of the Affordable Care Act across the states as a natural experiment to explore how policies that improve parental access to health care are associated with reduced rates of screened-in referrals for children under 6 years old. So specifically, the study found that between 2013 and 2016, the rate of screened-in neglect referrals decreased in the 31 states that expanded Medicaid, but actually increased in the 19 states that did not expand Medicaid. Based on this analysis, the authors estimated that if the 19 non-expansion states had expanded Medicaid, there would have been an estimated almost 125,000 fewer screened-in neglect referrals for children under age 6 in the United States from 2014 through 2016. The authors suggest that the increased financial stability in households and improved mental health of adults, both of which have been associated with Medicaid expansion, may contribute to a reduction in maltreatment of young children. So following up on that, numerous studies demonstrate that Medicaid expansion is associated with a host of positive outcomes for children and families, including increased housing stability. As you can see from the visual on this slide, evictions fell by 20% in states that expanded Medicaid compared to non-expansion states. By providing enrollees with financial protection from high medical bills, Medicaid can free up income that enrollees can use to pay for rent or to avoid eviction. Today, 40 states and DC have expanded Medicaid, and North Carolina's expansion will be effective in December of this year. The findings of several studies focused on the Family Connects home visiting model suggest that when implemented with high quality and broad reach, a short-term home visiting program has the potential to reduce population rates of child maltreatment. So Family Connects is a community-wide nurse home visiting program for families with newborns. It's short-term and focuses on assessing family material needs and then connecting families to needed community resources. Studies of all families with births in selected hospitals in Durham, North Carolina over a 6-month period found that families who were randomly assigned to receive Family Connects experienced more positive maternal mental health, 44% lower rate of CPS investigations through their time their child reached age 2, and 39% fewer CPS investigations through the time their child reached age 5. Turning now to the body of evidence on early education and care. In this study, each additional month that mothers who are low income receive a child care subsidy is associated with a 16% decrease in the odds of a neglect report and a 14% decrease in the odds of a physical abuse report in the following 12 months. This study found that neighborhoods with higher percentages of 3- and 4-year-olds attending preschool are associated with lower rates of child maltreatment investigations and substantiations. This analysis modeled the effect of the universal child care investments that were included in President Biden's Build Back Better proposal on child welfare involvement and found that those investments would be associated with a 6.4 reduction in CPS investigations, 6% reduction in substantiations, 3% reduction in foster care placements, and almost 12% reduction in child fatalities due to maltreatment. I do want to note that the investments proposed were significant and supported a high quality early childhood and education system, as well as universal preschool. Turning now to housing, this is a study by my colleagues at Chapin Hall. It's a randomized controlled trial that assessed the causal impact of a supportive housing intervention for child welfare-involved families in Connecticut who faced housing instability. Families were randomly assigned to the intervention group, and they received a housing voucher and case management, while families in the control group received the usual services. It found that compared to the business as usual control group, families who received supportive housing experienced significantly fewer removals, a lower prevalence of substantiated maltreatment, and increased reunification. Wisconsin has launched a Family Keys program to address the housing needs of families involved with child welfare. It provides short-term housing funds to families with children at risk of removal due to housing insecurity and to families unable to reunify due to inadequate housing. These funds can be used for hotel costs, short-term rentals, and expenses related to finding and maintaining housing. Around 40% of households across the nation who are offered housing choice vouchers are unable to find an eligible unit due to discrimination and lack of landlord participation in the program. In response to this barrier, the Philadelphia Housing Authority launched its PHL Plus program in 2022. Through this program, 300 tenants on public housing wait lists were randomly selected to receive monthly unconditional cash payments instead of a housing voucher. Families who were selected had the option of receiving monthly payments averaging around $900 to help offset the cost of rent for 2.5 years. At the federal level, HUD hopes to launch a similar multi-site direct rental assistance pilot. Households selected from existing voucher wait lists would have the option of receiving a traditional voucher, which would be funded by HUD, or a monthly equivalent payment, which would be funded by philanthropy for a period of time. They're hoping the findings can be used to encourage Congress to provide HUD with authority to administer a larger demonstration pilot to inform future policy changes. Let's go back to TANF. This seminal study looked at state-level data on public benefit levels from 1990 to 1998 to examine the impact of welfare reforms on several measures of child maltreatment. It found that a 10% increase in state public benefit levels, in this study it was AFDC plus the value of food stamps, for a family of 4 is predicted to reduce foster care placements by 8%. So states have the option of increasing TANF spending on cash assistance for families. As you can see from this graphic today, most states spend only a small percentage of their TANF funds on cash assistance. In fact, total TANF spending on cash assistance has declined by 69% since TANF's first year when you adjust for inflation. Currently, 15 states spend less than 10% of all of their TANF funds on cash assistance. And 41% of Black children live in states that spend less than 10% of TANF funds on cash assistance. If you click on the link on this slide, you can see how your state spends its TANF dollars. This study found that easing TANF restrictions is associated with fewer children with substantiated neglect and fewer children placed into foster care. It estimated that around 29,000 fewer children would have entered foster care nationally from 2004 to 2016 if states had eased TANF restrictions to increase access for families. States also have considerable flexibility to establish policies that make SNAP benefits more accessible to families. This study found that states that had more generous SNAP policies, including policies that increased eligibility for SNAP, experienced large reductions in CPS reports, fewer substantiated reports, particularly for neglect, and fewer foster care placements. This longitudinal study looked at children in Illinois who were born between 1990 and 2000, and it followed this cohort through the end of 2001, tracking their WIC and SNAP participation, as well as substantiated child maltreatment reports. It found that children from low-income families who participated in SNAP or WIC had a lower risk of experiencing substantiated maltreatment reports compared to children from low-income families who didn't participate in either program. Let's turn now to family preservation programs that include concrete supports for families. This study found that families with open child welfare cases who received a home-based services program that provided concrete supports are 17% less likely to experience a subsequent child maltreatment report compared to families who received the program without any concrete supports. For families who report difficulty paying bills prior to receiving a home-based services program with concrete supports, the provision of clothing, furniture, supplies, or housing assistance is associated with reduced likelihood of subsequent substantiated maltreatment, and the provision of cash assistance or clothing, furniture, and supplies is associated with reduced likelihood of subsequent foster care placement. Kentucky provides up to $1,000 in flexible funds to meet the concrete needs of families participating in their family preservation program to prevent entry into foster care. And of particular interest to this audience is that Kentucky recently announced that up to $4,000 in flexible funds is available per family through community action agencies to meet the concrete needs of families with active CPS cases. So that's going even further upstream. The final section of my presentation will focus on building a family and child well-being system. So let's first consider our current system. The annual economic burden of child maltreatment is enormous in the United States. Total direct and indirect costs of child maltreatment total around $80 billion each year. Direct costs are things like hospitalization, mental health care system costs, child welfare services, law enforcement costs. Indirect costs include things like special education, juvenile delinquency, adult criminal justice system involvement, and lost productivity. However, when you look at the economic burden to society, it's much larger than that. $428 billion is estimated to be the annual cost to society of substantiated child maltreatment. So this is lifetime costs incurred annually. And $2 trillion is the estimated annual cost to society of investigated child maltreatment. You remember how many children are investigated in the United States. State and local child welfare agencies spend around $31 billion each year. You can see from this graphic that almost half of these expenditures are used to fund out-of-home placements in foster care, and less than 16% are used for preventative services. And of that funding, that 16%, less than 9% is spent on economic and concrete supports for families. The strong policy response by our federal government during the pandemic showed us what works and made clear that child poverty is a choice in this country. During the pandemic, the federal government temporarily reinvented the traditional U.S. safety net. Enhanced assistance in 2020 and 2021 included 3 rounds of stimulus cash payments, expanded unemployment assistance, TANF emergency assistance, emergency rental assistance, eviction moratoriums, expanded child care assistance, SNAP benefits, expanded EITC, and perhaps most importantly, the expanded child tax credit. As a result of this federal response, in 2021, the child poverty rate fell to a record low of 5.2% in 2021. And the Black child poverty rate declined from 17% in 2020 to 8% in 2021. And contrary to what many people were predicting, child maltreatment appeared to decline during the pandemic. The Census Bureau recently announced that poverty rose significantly in 2022 following the expiration of the pandemic era enhanced government assistance. The child poverty rate more than doubled to 12.4%, translating to 5.2 million more children living in poverty. So what can communities do? I want to highlight some effective ways that communities and community-based organizations can provide economic and concrete supports to families as a child welfare prevention strategy. Teller County, Colorado, has seen significant cost savings and reduced child maltreatment rates by providing supports and financial assistance to families screened out of child welfare through its family resource centers. An article I recently read noted that screened out families exist in a policy no man's land of sorts, meaning their elevated risks insufficiently addressed by our public benefit programs have brought them to the attention of child welfare, but their needs don't rise to the level warranting ongoing child welfare involvement. So they're screened out. Offering economic and concrete supports to these families and their community may be a critical strategy to prevent subsequent child welfare involvement for these families. Going even further upstream, this study by Chapin Hall found that neighborhoods in Allegheny County, Pennsylvania, with a family support center, had a 26% lower rate of first-time child maltreatment investigations compared to similar neighborhoods without a family support center. As I said at the beginning of my presentation, the research I shared with you today is actionable. Evidence-based policymaking will require collaboration across families and communities, child welfare, and human service agency partners. Most importantly, this work must be centered on the experiences and leadership of families and communities. Human service agencies must be reoriented towards preventing child welfare involvement and change policies by understanding the impact that their policy choices have on child welfare involvement. And child welfare must coordinate with system partners to provide upstream supports. To support evidence-based policymaking, we coordinated with APHSA, the American Public Human Services Association, to develop an economic and concrete supports policy analysis tool. This tool, which can be accessed via the link on this slide, presents state policy options across different mechanisms to increase family access to economic and concrete supports that are aligned with the body of research I shared with you today. This tool allows jurisdictions and organizations to assess their current policy landscape and consider future options to expand economic and concrete supports as a prevention strategy. I'll end my presentation with this visual pathway to preventing child welfare involvement that we've created based on the body of evidence. I realize there's a lot of text on this slide and some of it may be difficult to read, but you can also download this visual as a separate graphic from our website. In this vision, a comprehensive continuum of supports are provided to families upstream of any system involvement. These serve as critical infrastructure for families. If you remember the family in the overloaded truck from earlier in my presentation, you'll see here how the burdens or boxes are removed as the truck goes down the path. Each of the bullets in white text in this graphic relates to the research we've compiled at Chapin Hall. First, the truck goes through macroeconomic social policies, including increased minimum wage and stable employment, income equality and mobility, paid family leave, EITC, CTC. Then the truck goes through concrete supports station where it has access to healthcare, childcare and pre-K, housing, home visiting connected to resources, flexible funds to meet concrete needs, and direct cash transfers. Then the truck goes through the public benefit support network and human services, where there is an expanded, equitable, and integrated human-centered system with shared responsibility, outcomes, and accountability to prevent child welfare involvement. There's an assessment of family economic instability and risk at key touch points across human services. There are alternatives for mandatory reporters to connect families to resources. And then economic differential response, community pathways to prevention services, and navigation serves as a firewall to prevent child welfare involvement. After all this, the truck's boxes have been unloaded. The truck is no longer breaking down and the family drives toward the sunshine. However, for families who do enter the child protection and foster care system, and there are always families where this is going to be needed, there will be narrowed use of child welfare to respond only when necessary. Families would be offered legal counsel at first contact with CPS, economic and concrete supports, plus evidence-based practices to address families' intensive needs, partnership with families and communities to co-design a responsive and accessible service array that goes beyond just treatment, and continuous evaluation and monitoring of the effectiveness and impact of interventions. All right, I'm happy to answer any questions that have come up for you in my presentation. I think we have about 10 minutes. I also posed some questions here that I would really be interested in seeing group reflections and sharing anything in response to the questions. So I'm open to however you want to use this time.
Thank you so much. And I think we do have a good little bit of time here where we can answer questions. So let's see. I think we have something here. I put a question in the chat. You know, what might you do with this information, which is, I think, similar to what we have here. And Rachel says, I sit on the local community partnerships for protecting children board and co-present poverty simulations with the CPPC director in our counties. I plan to do a better job at presenting some of this data in our debrief session at the end of the simulations, asking participants for an action step of advocacy. And I'll just say poverty simulations. We have a community action poverty simulation that helps people to just begin to get a sense of, you know, what kind of material hardship, you know, does poverty bring? And it's a great advocacy tool to help educate folks as a first step. But then what do you want to do about it? So Rachel, I love that you're doing that, and definitely agree there's more to do there. Interesting that after COVID, maltreatment went up, importance of family connections. So you actually, I believe, Karis, can folks unmute themselves? I think.
Yes, they can.
Yeah. So I'm just going to see if anybody wants to unmute, and we can even take the slides down, and that way we can kind of see if people are talking. But would anybody like to ask a question or share a reflection of what they're, you know, going to do or how they're going to use this information? Or you can put it in the chat too if you don't want to unmute. What's bubbling up for folks?
Jeannie, hi, this is Jennifer Corcione from down here, Community Action down here in LaGrange, Georgia. I don't know what my plan is just yet, but I will say that in our experience working with our local DFACS offices, which is, you know, where these child CPS offices are tied into, they very rarely have resources to support these families, almost never. So they're creating plans, you know, or helping the family create plans for reunification that are, in my experience, unrealistic, because the family has no, where are they going to go get a parenting class? And it becomes this futile effort of just pie in the sky dreams for these trainings and these resources that they want these, especially in an area like where we serve, Meriwether County, Georgia, where there's, forget about resources on parenting. There's not even grocery stores, you know, it's like, what do they want these families to do? But the network, the Community Action Network, has a real opportunity in this space. And at my agency, I serve 5 counties, and they're very similar to Meriwether County, rural, you know, not very populated, certainly not a lot of resources, although we're not very far from Atlanta. You know, Coweta County is not that far from Atlanta. That's Noonan, Georgia. But some of the outlying areas of that county even feel like they're on the outskirts of nowhere. But anyway, we're going to try to bridge the gap just regionally for my little counties and try to get some form of supports going for some of these families. Because I know that in our working with just a few of those DFACS offices, they have no resources. There's nothing.
Yeah.
They forget about concrete supports. There's no supports. There's nothing financial for sure. A lot of times the community action agencies step forward with housing stipends and supports of that nature. But when you're talking about, you know, parental supports, how-tos and trainings and things of that nature, it just doesn't exist. So we're going to try to put together we're building a strategic plan right now that's building some of this into it, where we're going to try to bridge the gap in that way to try to create a program, if you will, for some of these families that are struggling. Giving money is the easy part. I think it's figuring out how to get the families, it's more than just economic shifts that you have to battle, especially in these rural areas. There's no transportation. How are you going to get them there? You're battling generational poverty. Giving them a stipend is not what it's, they may not even have income. Some of these families are 100% public assistance. So there's a lot of other barriers, but community action has a real opportunity in this space, I think. And certainly in my region, we're going to try to do something to try to fill in the gap there.
Yes. Well, thank you so much for sharing that. I hear some interest and excitement, some motivation in all that you're saying. And I hope that and suspect that others are feeling that. I think that there are some ways that we can do a better job of it at a systems level, not just depending on the families to make these connections, but what can community action leaders and child welfare leaders do together to connect up the systems and the resources that families need, so that it's not left to chance that that family will get the parenting support and the housing supports and all the things that they need to make sure that the family is stable and thriving. There's just some really interesting things coming into the chat that, we have somebody who does 2-gen whole family approach work and has coaches and is saying, we can probably look at how we connect up families to more of our whole family coaches. And I think there's definitely an opportunity there. The reducing silos, flexible funding, the importance of that has come up. So let me pause there and see, Yasmin, if there's anything you want to react to that people are saying, or I can read some other things in the chat, but I want to give you an opportunity.
I'm really excited about all the comments in the chat. And I do want to say, in terms of reunification, I didn't share it today, but we have a slide and some data that's in the deck on our website that shows that when families lose income post their child entering the foster care system, it takes longer for them to reunify. So often you lose your TANF benefits. When you lose children, you might lose access to some of your benefits when they're. So we make it almost impossible for families to reunify. We take away their income for families who really need that income, and we make them go through all these hurdles to get back their children, which ends up being more traumatic for everyone and just long-term cost increase. We know that foster care is incredibly expensive and does not have good outcomes for children most of the time. So I want to thank you all for raising that. I see a comment in the chat by Mark Hertzfeld around reducing silos. And this is an issue everywhere, because as I talked about initially, it's like our funding drives our services and creates silos across our human service agencies. And I really think that it starts with raising awareness of all of this body of evidence. And really, I think leadership needs to have a shared vision and come together. Like, it needs to start with leadership understanding this research and understanding that child welfare cannot do this work alone, and it must be done in collaboration. But this is a problem across the nation. I mean, I think we're starting to see more initiatives that are trying to reduce some of those silos, but I do think this is an ongoing issue. I mean, I'm seeing some agencies develop like shared visions and collaborate more, specifically TANF and child welfare, because there is so much cross-system involvement there. I'd be interested if anyone else has anything to share about what succeeded in reducing some of those barriers, because at the same time, I'm seeing a comment that sometimes community action agencies are hesitant to work with CPS because they're worried about children being removed and increasing surveillance. This is also a very real concern. So I think the comments in the chat give us a lot to think about.
Yeah. I think that, one of the things, I've worked in community action for over 30 years, and I started out at community action agency. I've seen into a lot of different community action agencies. And one of the great, unique, value added things about community action is we're often not seen as kind of the state. We're seen as more community based. And I think people sometimes will come to the community action agency and accept help when they won't go other places because there is some kind of fear. And I think that's an opportunity for us. And I think it does warrant thinking very creatively with your child welfare colleagues about how to capitalize on that. And I think, and we didn't go into this too much today, but Krista, who was from Chapin Hall on our first webinar, talked a lot about the Families First Act. And, that is starting to permeate the child welfare field. And they're getting very interested in finding ways to, do prevention and intervene early. And so I think you all, community action folks who maybe haven't had conversations with your child welfare colleagues in a long time, might find that they're in a different space than they might have been in the past. And they may be looking to find these new and innovative and creative ways that you can work together. So I hope that if you're not in conversation already, that you as leaders will go and sit down and talk about, we just all have to do better for families. Like that, we just, if the statistics that we saw today in the research doesn't make us mad and break our hearts, I don't know what will, right? We have to do things differently. We have to find new ways. So I should get off my soapbox. I'm sorry. Other comments or questions or thoughts that folks have, just maybe one more, and then we'll probably have to go to our wrap up. Anything else? Tiffany Marley, are you still there? Do you want to make any high level NCAP comments? They have stepped away. Very good. This chat, we're gonna take this chat and mine this for the future as we move forward with our Chapin Hall colleagues, because there's some great stuff in there. Any final comments on anybody? Okay, Karis, we'll hand it back to you.
All right. Thank you, Jeannie. And thank you, Yasmin, for such a great presentation, and for all of you for your engagement in the chat. This has definitely been a great conversation. As we close out today, we want to hear from you. So I'm going to share a link in the chat. You can also scan the QR code here on your screen. So we want to know your thoughts on today's presentation, and just know that your feedback is very important to us as we move forward. So we would appreciate you taking a few minutes to complete the survey here. And then we also want to just share with you some upcoming resources and events that we have coming up here at NCAP. So first, we have coming up next week our new Executive Director Institute. That will be October 31st through November 1st in Alexandria, Virginia. You can learn more by scanning the QR code here, and we'll also put the link in the chat for you as well. We will also have, following the new Executive Director Institute on November 2nd and 3rd, we will have an Executive Director and Board Chair Symposium. So again, you can find out more information about that by scanning the QR code or following the link in the chat. We also have our Management and Leadership Training Conference coming up. So we will be in Las Vegas, Nevada, February 14th through the 16th. And we hope that you will make plans to join us, and we'll share the information for you to learn more about that. And you'll have all this information in your follow-up email as well. You may have also seen that the Community Action Academy, our online learning platform, has a new look. So that is now live, and we have a guide that's available for you to download to help you with navigating and getting started on the new platform. We also have Fresh Finds. This is available on our website, where you can access the latest resources, webinars, and funding opportunities from other organizations who are engaging in anti-poverty work. And we keep that updated periodically. So we encourage you to check it out and see what is currently available. And again, we just want to thank you all for taking the time out of your busy schedules to join us today. And thank you again to our presenter. We appreciate you all and hope you have a great rest of your week. Thank you so much.